Hi everyone, I'm Maryam. I'm really excited here today to tell you about my vision for Nexus, which aims at decoding the brain, ovarian, gut network. Today, we know that our body is in one interconnected network, and many chronic conditions share the same root causes. Specifically for women, the brain, ovarian, gut network results in a downstream cascade of conditions from osteoporosis to cardiometabolic diseases to autoimmune diseases. These diseases affect over 1 billion women globally and 50 million women in the United States. Nexus aims at building the first fully integrated platform that senses, models, and treats this interconnected network. So what's the problem? What's happening today? Take a woman with polycystic ovarian syndrome. She goes sees an endocrinologist. She gets metformin because there's nothing else. It works about a third of the time, and the rest is trial and error. Same goes for women in perimenopause going to neurologists complaining of brain fog, bone loss, cardiometabolic functions, and on and on and on. Each of these diseases by itself, it's a multi-billion, if not tens of billions of dollars market opportunity. Imagine if we could develop interventions that could treat multiple of these diseases at the same time. Today, what's happening, we're treating them all separately with different physicians, and we're failing half the time. I repeat that, more than half the time we are failing women. Here's an example. Take FSH, or follicle-stimulating hormone. Traditionally, we thought it just affects reproductive health. But now we have proof and data that shows receptors for FSH sit on our bone cells, on our fat cells, on neurons, and our blood cells, creating a downstream of chronic conditions. As women enter perimenopause, the dysregulations and changes over time in FSH doesn't just signal reproductive aging, but it becomes a driver for all of these chronic conditions. So you may ask, why now? Over the past 5 or 6 years, multiple paradigms have shifted, whether we're understanding the biology or we now have the tools at scale, whether it's metagenomics or AI or deep biological sensors that can track and model this network. And we are finally coming to consensus that a lot of these diseases are network diseases. For example, just this past week, PCOS was renamed as polyendocrine metabolic syndrome. This is really important because we now are finally understanding that these are network conditions. Here's an example of the network Nature paper by Ziaei's lab that establishes the FSH biology. We now can, thanks to metagenomics, measure gut microbiota that regulates estrogen and other hormones at scale. And we have really cool biochemical sensors. This one is from Caltech, or this one from Georgia Tech, that can measure these signals. The science and technology is ready. And Nexus aims to bring this all together in 3 integrated components. The first one is a continuous multimodal sensing, measuring 3 different axes: the stress axis, the reproductive axis, and the gut axis. The second component not only aims to model and establish the causality, but stratify patients by the network state, but the specific axis that's driving their specific dysfunction. And finally, the third component aim to develop interventions that not only new targets, but drug repurposing and personalized hormone therapy that can close the loop. And through it all, every single in this platform, every single treatment is a control perturbation that we can measure with our sensors. And hopefully over time, we can improve our models with that data. Speaking of the data, all the data I plan to put in an open source data repository that will become a huge asset for this program, that as the program moves on, even beyond the program, can be interrogated for new targets, building new tools, and new digital health platforms. This is a 5-year program, about 80 million total budget. Phase 0 aims to de-risk the technical aspects and raise the full funding for the program. Phase 1 aims at developing sensors for 2 of the 3 axes and establish the causal models and initiate that computational drug screening. Phase 2 expand that to the 3 axes, and phase 3 will generate the preclinical data required to move on. You may ask, there are a lot of consumer variables. We aim to take that deeper and close the loop by measuring the dynamics, not just point-in-time measurements. There are really cool programs out there that are developing and become enabling, and we hope to partner with them. And you may ask, why philanthropy? We are bringing 3 different distinct areas together, and neither investigator nor company owns that. Nexus will cross that integration valley of death and create fully integrated, validation-ready data that pharma and other strategic partners will take and move forward. A little bit about myself. My background is MEMS and sensors. After that, I started my own startup, which was the first of its kind FDA-cleared AI wearable for breast health. Led that through early commercialization, and the last 3 years I've been at ARPA-H, leading technology transition. And I'm incredibly lucky that I've been working with a strategic advisor, Dr. Wegerson. She doesn't need an introduction. And so many strategic and scientific advisors, too many to list here, who have helped me build this program, and really excited to build upon that. Today, we're raising 8 to 10 million, which will become the seedlings for the full program, which will allow us to de-risk some of the most difficult, challenging sensors, run some small subtyping studies, and develop the basic models that will launch into the full program. Finally, I wanted to thank you all for joining me along the path to transform women's health, and please come talk to me if you have any questions.